Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about nerve biopsies, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, supporting evidence ideas and some helpful tips that can make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the subsection. The portfolio offers indicative repertoire for this section that includes hematoxylin and eosin, Luxil Fast Blue, Gomery trichrome, glial fibers, myelin, neurofibrillary tangles, senile plaques, Nissl substance. Knowledge requirement is what it is expected of you to know and understand to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, validate, help others and maintain high-quality service. Let's have a look at the first knowledge requirement, which is for you to know the principles of nerve biopsy sampling. What is the principle of nerve biopsy sampling? How and why are those samples obtained and sent to histology? Consider optimal specimen site and selection, surgical method used like open technique, sample handling like rapid preservation via snap freezing or fixation, multifaceted analysis via various stains, tissue evaluation. The second knowledge requirement is for you to know the principles and practice of direct visualization, routine staining, and histochemical and impregnation methods for nerve tissue. What are the principles and practice of direct visualization of nerve tissue? What direct visualization techniques can be used for nerve tissue? What routine, histochemical and impregnation methods can be used for nerve tissue? What techniques are used in your department? Why are those techniques used? What do they demonstrate? Consider sample transport, handling, method used like freezing, fixation, EM processing, orientation of sample, cryotomy, micro or ultramicrotomy, staining techniques used, interpretation of stained sample, purpose of each method used, storage of sample following analysis. The third knowledge requirement is for you to know the principles and practice of handling fresh, frozen and fixed nerve samples. How would you handle fresh, frozen and fixed nerve sample? Consider their primary use and the procedures. What is the difference between them? Consider proper sample handling, careful approach to minimize mechanical damage, time sensitivity, orientation, freezing, fixation, processing, cryotomy, microtomy, ultramicrotomy, staining, interpretation of findings, purpose of each method and storage of samples following histological analysis. The fourth knowledge requirement is for you to know the ancillary methods used with nerve samples. What ancillary methods are used for muscle biopsies? Consider special stains, enzyme histochemistry, IHC, if EM, molecular and genetic testing, teased fiber preparation and morphometry. The fifth knowledge requirement is for you to know the risks and hazards associated with nerve samples. What are the risks and hazards associated with nerve samples? How would you minimize them? Consider risks to patients during procedure, risks to the lab staff like infectious risks and exposure routes, technical hazards associated with processing during freezing or fixation, chemical hazards associated with reagents used during processing and staining, risks associated with reagent and sample storage and disposal. Also consider possible mitigation strategies like COSH, use of PPE, SOPs, waste segregation, risk assessments, safety data sheet, ventilation. The sixth knowledge requirement is for you to know the diagnostic relevance of nerve biopsy. What is the diagnostic relevance of nerve biopsy? What diseases can be investigated on nerve biopsy? Consider the diagnostic relevance for disease diagnosis, therapeutic impact, fiber evaluation, and pathological deposits identification. Also consider diseases that can be detected on nerve biopsy like inflammation, demyelination, amyloidosis, neurolymphomatosis, neurosarcoidosis, various neuropathies, storage disorders or axon degeneration. Competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard and level. Your chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this section. Let's explore the first competence requirement, which is for you to discuss the application of nerve biopsy demonstration techniques. What demonstration methods are used for nerve biopsies? What diseases can they detect? Consider demonstration techniques in indicative repertoire and techniques used in your laboratory, their application, and diseases they detect. The second competence requirement is for you to select and use correct visualization, staining, histochemical or impregnation methods to identify elements within nerve biopsies. What demonstration methods would you use to identify various elements within nerve biopsy? Consider SOPs, method used, elements identified, quality control, use of control material, your training and competency. The third competence requirement is for you to select and use control material, maintaining audit trails. What control material would you use for demonstration methods of nerve biopsy? Consider tissue type and availability, verification and validation of control material, record keeping, traceability, audit trail. The fourth competence requirement is for you to use microscopy techniques to visualize methods, as appropriate. What microscopy techniques would you use to visualize demonstration methods used for nerve biopsy? Consider light microscopy, IF and EM, magnification, Kohler's illumination, digital. The fifth competence requirement is for you to identify stained elements within nerve biopsies. What stained elements can you identify when assessing nerve biopsy? Consider each staining method and the elements and nerve structures they highlight. Also consider microscopic examination of stained slides, your training and competence. The sixth competence requirement is for you to assess stained sections for quality. How would you QC stained sections of nerve biopsy? Consider specificity of staining, uniformity of staining, presence of background staining, contamination or deposits, presence of nonspecific staining, UK NICA's assessment criteria, control material used, or documentation. The seventh competence requirement is for you to resolve any associated problems with the staining or histochemical methods, including root cause analysis, as appropriate. What types of staining problems can you encounter? How would you resolve them? Consider investigation, problem identification, corrective actions to issue, preventive actions to minimize problems from reoccurring. Consider possible problems like poor staining intensity, poor specificity of staining, artifacts like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, effects of fixation, processing and antigen retrieval on quality of staining, nonspecific staining, background, absent staining, or cross-reactivity. The eighth competence requirement is for you to dispose of waste reagents and residual material safely. How do you dispose safely reagents and residual material? What disposal risks are associated with those reagents and samples? Consider licensed contractors used by your lab, waste segregation, safety data sheet of reagent often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Also consider risks associated with disposal or residual material like human tissue. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also needs to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for this section. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.